Hi, this is Liz Wallenstein of LizWallensteinTherapy.com. I'm a therapist available online and in person. I'm going to talk today about one of my areas of specialty as a therapist, which is treating chronic pain through the mind and emotions, the mind-body connection. And it's a topic close to my heart because of my own recovery, complete recovery from physical pain using the mind-body connection. And then using those mind-body principles towards a recovery from a serious illness as well. If you're interested in hearing more about that, you could check out my website. I talk a little bit about my story there. But for today's topic, today's question, I often hear the question, is therapy necessary in order to have a recovery from chronic pain? So I wanted to address that. I think the question itself is already telling because a lot of times the person asking it is treating therapy like it's this undesirable thing to be avoided. Can I get away without having it? And that often says a lot about how that person views their own feelings, their own needs, how they treat themselves. Because, I often ask, well, what's wrong with therapy? Like, why not have somebody care about you? Why not have somebody give you their full attention? Why not have that time that's designated just for you and how you feel and getting your feelings out? Like a lot of times, I think that the person asking that question is a little bit uncomfortable with being a feeling person or being somebody who has needs. So a lot of times the question is telling in itself. But the other part of this is that in my work, working with chronic pain patients, I find that a lot of these people had something missing in their kind of emotional nurturance from growing up. So whether it wasn't there enough or wasn't there consistently, their feelings and how they were doing emotionally just wasn't given the proper attention or the full attention. Um, Maybe they felt invisible, maybe they felt dismissed or ignored, or maybe the parent was too preoccupied with their own things or with other stuff going on in the household and wasn't able to be present enough with that person. And because of that, what I've found in people's recoveries is that the therapist kind of individualizing the treatment, like asking them the questions, really trying to get to know them very carefully, listening very carefully, caring a lot about how they feel, allowing them to really take in what they're saying, to really feel what they're saying, not just to speak from up here, but to really feel it in here, is very healing. Because I think ultimately any person, the number one thing we really want is to feel gotten. And in therapy, a lot of times, hopefully, ideally, you should have that experience of feeling gotten. You should have the experience of feeling really deeply seen, deeply heard, cared about. Um, and and I think that a lot of times is the missing piece in people's recoveries. Do people recover without therapy? For sure, there's been people who have. It's not everybody that could use it. There's also people who will recover but then have relapses, and and therapy has played a role in terms of making it go away for good. But a lot of times, the people asking this question are people who have worked on it mentally and still not gotten as far as they would like, not gotten it away completely. And so that's why I refer to it as the missing piece. Like the missing piece might be that experience of just like seeing yourself reflected back in somebody's eyes, which would be the therapist. Because especially in today's day when we don't really know how to listen to somebody, we don't really know how to kind of take turns and really let it be about somebody else for a little while. We're kind of always rushing in to give our opinion or make sure that we're heard. Or we have a lot of things like social media. They give the illusion of being heard, or give the illusion of being seen and connected, but it's kind of like candy. It's not the real thing. So people walk around with this void and this loneliness, and so especially if you've had that for a very long time, that kind of undoing the loneliness through the therapeutic relationship can often be that missing piece that helps a person get better that wasn't there beforehand. So I hope that was helpful to you. If you have any questions about what I said, or really any questions at all about the mind-body connection and how to heal from chronic pain and possibly illness using psychology, thoughts, emotions, please feel free to put them in the comments of wherever you see this video, because I'm passionate about helping people in their recoveries, and so I want to know what your questions are. Thank you so much. Have a great day.